Hello, everyone. Welcome to Abby's YouTube channel on our segment of Ask a Doctor. With us today is Dr. Raphael Ugochukwu Chikeze. I know him as Dr. Chike. He's a consultant obstetrician and gynecologist at AE FUTA, which is Alex Ekweme Federal University Teaching Hospital, Abakaliki. He's a he has special interest in gynae oncology and also fetal maternal medicine. He's also the assistant state coordinator of Sogon Ebonyi State Chapter. He's a happily married man to a lovely wife who is also a midwife. Very good one, and a father of a beautiful daughter. Yeah. He's also our gynae and obstetrician with Abby Cares Foundation. So Dr. Chike has been with us from day one. I call him a champion in women's health because he's always saying that women's health is complicated. So Dr. Chike, we are glad to have you. Welcome.
Thank you so much for the opportunity and giving me the time to come and express myself and also ask. I also attend to some women issues because that's where my passion lies.
Yes.
Yeah, and I'm also a major stakeholder, like she's rightly said, in IB care. So
yes. Yeah. Dr. Chike, welcome.
Thank you for having me.
So November 17th is a Cervical Cancer Awareness Day. And you are the best person to talk to about the issue of cervical cancer. And I think the theme this year is Act Now and Eliminate Cervical Cancer. And I think they are pushing more on the vaccine and screening approach, which is a preventive method. So let's start with cervical cancer. What is it? So you can explain to us in the simplest term.
Okay. Cervical cancer is one of the major cancers that affect women. In the world is ranked fourth, the fourth most common cancer that affects women. And where the cervix is located is like what we call the mouth of the womb.
Yes.
It's part of the womb, just where the baby passes through. So when the cancer affects it, that's what we call cancer of the cervix. And it's really causing a really big toll on our women, especially down here in low and in middle income countries, because it's really affecting our women, and most of the time they usually present late, and most of the deaths that occur during this for the associated to cervical cancer occurs more in sub-Saharan Africa, where we have Nigeria as part of it, because in 2022 we had about more than 600,000 cases.
Wow, that's a lot.
And 355,000 deaths.
So that's
so you can see that's almost over 50%. And more than 90% of those deaths occurred in the sub-Saharan Africa. So wow. And the good thing about it is it's a preventable disease. It's a preventable disease if caught early, through early detection, early treatment can save a lot of lives. So that's why this team to this year, and this is the first time they are dedicating a day for cervical elimination awareness. So as for everyone to put hands together, we have a lot of awareness. Now we should act. Everybody needs to act and ensure that things are done to prevent our women from dying.
You mentioned vaccine, that is one of the preventable cancers. You mentioned vaccine. And I know the HPV vaccine has not always been available. I think I was in graduate school when it came out. This was like in 2005, 2006. And it was a big breakthrough in medicine and in public health community. But sadly, a lot of people are still not aware of the HPV vaccine. But the good thing now is that in Nigeria now we're rolling it out, and they said it's part of they're trying to make it part of the immunization schedule and everything. So can you please kindly elaborate on the need for the vaccine and how can someone get the vaccine? Where do they go to get the vaccine? And also, is a vaccine only available to certain age group and gender?
Okay, thank you for the question. It has been found out over the years of research and studies that most the what causes cervical cancer the most is a virus that we call human papilloma virus.
Yes. Okay.
So and it's transmitted through sexually. It's sexually transmitted. It's a sexually transmitted disease.
Okay.
And though over the years the body can if your immunity is strong and it can take care of it, clears it out of the system. But when it's persistent, and there are some types of the virus, it calls high risk. We call it high risk, the high risk virus. Not all the types of the HPV in the short form. We call it human papilloma virus. So I'll be using HPV so that interchangeably. So it's due to when there's persistent infection and the body is not able to clear it out. That's when it now starts causing changes in the cells. Then change the normal cells to abnormal cells. From there, it will now develop into cancer. And it takes almost 10 to 20 years.
Wow,
so
that's a long
from
time.
the studies, they had to now develop a vaccine that, if taken early before the girl child or the woman if it takes it before her sexual debut, it will help to prevent even more than 90% of the cancers, cervical cancer. You will not be able to develop it if the girl child takes it. And usually, the ideal age usually is supposed to be taken before the child starts to have sexual intercourse. So usually, ideally, given between 9 to 14 years.
Is it sexual intercourse or menstruation? Which one?
No, it's sexual intercourse.
Okay, because I've heard
before
before
sexual debut.
Yeah, just want to clarify that.
So,
okay.
So it's better you give around between 9 to 14.
9 to 14.
And so it's both for girls and for the boys. So, like you said, it has been there for almost more than 10 years now in other
countries,
developed climes. But it was started, I think, like last 2 years or last year.
Yes.
They started a campaign on HPV, and they started only for the school girls, girls that are still in school, in primary schools. That's 9 years to 14. Then girls in primary school and secondary schools, early secondary schools. So, and they are giving, now the campaign is they give only one dose, but ideally it's supposed to be at least giving two doses. But they said if one dose is able to also give enough protection, more than 90% protection. So, and is available in some of our primary health centers in Ebonyi State. Even in my institution, Alex Ekweme, we have it in our Institute of Child Health.
Okay.
You can have access to it.
So someone can go to the hospital through the Well Women Clinic or through
they will screen you, then check whether you are suitable for the vaccine, and then they will give you access to the vaccine.
Or you can also go to the primary health centers within your community. Yes. Okay, so you mentioned, we've talked about the vaccine and the age range to get it, and we see that the vaccine is highly effective. Now, because we've done cervical cancer screening, which you've been part of, and you keep pushing that. So for the women in rural communities, will you highly recommend screening for them? And if so, how often should they be going for the screening, for cervical cancer screening?
Definitely, it's very, very important for any woman within the productive age to go for screening. Because as far as you are within the reproductive age and you've started giving birth, you are very at high risk of acquiring that HPV infection. And if it's not cleared by your body, it can now progress. If it's not detected early, it can now progress to cervical cancer. So in Nigeria, Sogon also has a guideline on cervical cancer screening. So we usually start at age 25. As from age 25, with the newer tests that we've added now, there's a high performance test where you add the HPV testing. We now test for the HPV and then also look at your cervix, where we look at it and inspect it and see whether there's any issues with the cervix. We call it visual inspection with acetic acid. Then there's also pap smear where we do it in the teaching hospitals. But the VIA, the visual inspection with athletic gas, can be done in the primary health centers, or like the one we did in our outreaches that we did at Onweke and also Izofu.
Yes.
So I expected you do it every 5 years.
Okay.
Every 5 years. With the if the person did HPV test with the screening, if it's negative and there's no issue, you have to now do next one every 5 years till you get to up to 60 years, 60, 65.
Then you don't need
you don't need to further screening again.
And that's because
with when the woman has gone into menopause and they are not at high risk of developing
it again.
Because with the negative screenings that we having shows that you can't progress any further because it takes almost 20 years for it to progress.
Okay. So, cancer is known in stages. So cervical cancer is not an exception. So for someone that has already been diagnosed with cervical cancer now, what kind of treatments is available to them depending on the stages? And also, I know this is a very touchy topic, but what the survival rate for cervical cancer?
Okay. Like rightly said, there's different stages in the cervical cancer. So we have the early stages and the late stages or the advanced stages. So one of those, while we're talking this about the prevention, if it's detected early at that early stage, there's depending on the woman that came, if she still wants to, still has based on her future reproductive career, still wants to still give birth, we might just remove the part of the cervix.
Okay.
And now just remove the part of cervix. Then maybe you will now tie it. What we call cerclage, cervical cerclage, so that maybe she can still continue to give birth and able to retain. Maybe she will not have any miscarriages or preterm delivery. But if things that we do for
Doc, I know you work with us in Abicare. You've been with us from day one.
She has completed her family by the time we detected that is in the early stage. The uterus or the womb can be completely removed.
So hysterectomy.
We'll do a hysterectomy, which will help to treat it, because most of the time when you remove all the uterus and with the surrounding structures, you just do the hysterectomy, remove the womb, is able to treat the cervical cancer. Then she will continue to be doing her screening over time, but they don't help. That's for the early stage. But when it now is already advanced, what we now do is just palliative care. And in palliative care is based on the symptoms that the patient presents with. If she is presenting with pain, she will ensure that she's pain-free. If she comes with abnormal discharge or bleeding from her vaginal bleeding, we'll have to give her something that will stop the vaginal bleeding, and also antibiotics to stop the abnormal discharge.
Okay.
And then the main aim of treatment is to make them comfortable, to improve their quality of life, then to help the person to set things up. If she wants to write her will or to share her properties and all that, to make peace with.
Just get ready.
So just give her time to get ready. So the other things, then there's also where you can use radiotherapy to also help to reduce the pain and also give her time. So those are a
lot of things in our health system we've gotten right before at the primary health sector level. And we understand that things are not always the way we want them to be. So for the fact that Abicare's foundation focuses at the primary health sector, what role do you think PHCs and NGOs play in disease prevention and eradication relating to cervical cancer? And is this something that you will encourage to continue, and something that will have an impact when it comes to disease prevention, when it comes to cervical cancer?
It's very important, because they are the first line, actually the primary health centers and with the NGOs. To eliminate cancer, you have to make services accessible, affordable, and also make it available. So if they at the community level, so that's where you can get the main people, the rural women and women. So when they is close to their doorstep or close to their community, they'll be able to access these services.
Because I remember when we had that outreach where we had the cervical cancer screening, the women refused to come out. You know, you keep saying, let's go and talk to them, talk to them. Find somebody, find a woman leader, find somebody that will go and really, really convince them. And then when when the woman leader showed up and you people, you know, screen her, then the other women now, you know, started coming. And to the point now that you guys became overwhelmed and it was like 3 of you guys, you know. So they requested that we come back. So I think community engagement, getting them at the rural level is very important, because one of the things you were even telling them was it's not painful. It won't take long. And when they see this person go in and come out, okay, you've done it. Okay, you know, you go and come out, and you know, is something that needs to continue, and we need to really, really push it.
No, women, when they have this sacred, there's this attachment to their womb and to their privacy.
Yes, so, because they were saying, they want to remove my they want to remove my womb. Nobody's removing.
So those are the myths and the misconceptions they have. So when they have someone that they're like them and talking to them at that community level, it helps to reduce that aversion and that restraint to
and they even open up with other gynecological issues that they had.
So that's where the role of the NGOs and the PhDs, they need to collaborate. So while the PhDs are the front line, they have to have access, give access for the cancer prevention, also offer these services, the HPV vaccination, screening. Then if there is any issue that is beyond that, they will refer to us. Then there's this integration that which I think the federal government, there's a program that is coming up. I want to integrate some of these normal activities they do in the PACs. We now integrate cancer screening services to it. So that as soon as the woman comes for antenatal visit, they can now access the screen at the time. So that it will not be another thing you start calling them, I need to come. So at that ANC, while they're giving them those health talks, you tell them about this cervical cancer and other cancers, which if their husbands also come, they also tell them about prostate cancer and all that, and they can have access to those screening. Then the NGOs will now come in to conduct outreaches, also help them in training, improving their capacity, and liaising with the government to institute policies. And even help to go into those hard to reach areas, because those are one of the roles of the NGOs to help, just like how we have an IB care where we go, like Aisafu, you should know how far it is, but we're able to reach out because we also improve the what's it called?
The PHC.
The PHC uptake.
Viability.
They were able to start coming and accessing services there because of our presence there. So those are one of the things the NGOs and the PHCs need to do. Prevention is better than cure. And to save a lot of cost. Because we don't need to start building cancer treatment centers. It costs a lot of money to even treat the cancer, even radiotherapy, chemotherapy, all those. But if you can nip it at the bud, when they come, we screen them and just burn it off with some of the treatments, simple treatments we can do for those pre-cancerous stages. They will not need to now start developing cancer, which will now be a burden.
And you know, one thing we don't really see is the economic and the emotional impact of this type of diseases, you know, because any disease that affects mostly women, you know, you're looking at is affecting the lineage in the family. Just to wrap up, so we've talked about cervical cancer, what it is, treatment options, the importance of screening when it comes to prevention. We've also talked about the role of PHCs and NGOs collaborating in providing services. You've seen a lot of cases in your realm of practice. So what advice do you give, not just to women, but to everybody that has a female in their life when it comes to cervical cancer?
Preventing cervical cancer is only possible, but it has to be urgent. It's an urgent action now. We have all the tools, we have the knowledge, we have all the researches and studies have been done, everything. The vaccine is available, but we need to now act now. It's a call to act now. Everybody has to be, it has to be bold, consistent, and collective. And it has to involve both the government, the youth, the communities. Everybody has to be an agent of a messenger of prevention. Let's turn our awareness to action.
I think that's,
and
that's
let's
a big one.
protect our next generation of these are girls that are growing up. Let's protect them, protect their future. Because if we ensure that they are screened, they have this, get this vaccinated, they are educated, they also go to school and they're empowered. They were able to access these services.
Yeah.
So don't keep the girl child at home and sending your boys to school. You should need to train the girl child so that they can be empowered and able to access these services. So they can get screened early and get vaccinated early so that this menace will stop and will not affect their future. Because whenever a woman dies, the whole community
the whole
dies.
community dies, yes. So thank you so much, Dr. Chike, for stopping by. And I hope you guys enjoyed the show. Let us know what you want us to cover next time. Comment, like, share our page, Abby Cares Foundation. Our website is still the same, www.abbycares.org. See you next time.